This is Dr. Shelby with the Wilson Knight Eye Institute. Let's talk about Zepto and LAL, especially after RK. Zepto is a wonderful unit. I like to use this with my LAL, especially with the RK patients, instead of the femtosecond laser, because there's not the degree of post-laser meiosis that you see. The Zepto, of course, radio frequency makes a perfectly centered 5.5 millimeter capsule rhexis. The key with RK patients is making sure you get it directly in between two of the RK cuts. This patient had 6-cut RK, which made it a little bit easier. If there are 8 or more cuts, sometimes you got to go a little more posterior in order to avoid those incisions. And of course, you do your cataract surgery like normal. And look at that floater, that thing's huge. I like to fill up first, and then loading the LAL, you want to grab one of the haptics. Of course, put a decent amount of viscoelastic in the cartridge. Make sure it's seated centrally. You want to get those edges in the groove. I like to open up the grasper, push down, make sure it's bending posteriorly. You want that leading haptic to face down. I like to bounce on the cartridge. You can see how that leading haptic is facing down. You loop that trailing haptic above that little post. Click it, you make sure you line it up in the injector, get it all the way to the end, and then rotate until you kind of feel it lock. I like to watch the optic engage, make sure that trailing haptic is smooth and that the leading haptic is pointing straight out. We use a 2.4 millimeter incision, so I like to widen it just a little bit to get that injector in. As I begin to inject, I do not rotate the lens yet, then begin to rotate so that it pops out in the correct orientation. I then retract the plunger, rotate a little bit more so you can engage the trailing haptic, and then push that haptic in, rotate one more time, and allow the whole lens to pop in. I like to make sure that it's well centered and that the capsule rhexis overlays the edge of the optic. And of course, remove your viscoelastic as normal. Make sure that lens is centered, and then I like to hydrate as usual, making sure that the RK incisions are not split open. Make sure the pressure is good, and that's it.